Good afternoon, everybody. I'm Iman Majd. I am the director of the Osher Center at University of Washington. Wanted to thank you all for making the time in this beautiful afternoon, coming to this beautiful venue. The topic that we have for this series is Care for the Caregiver. But before we get to the Care for the Caregiver, I would like to thank the Osher team here. We have Rachel Comini at the back, Carolyn Kim, Nana Del Rosario at the back. Thank you for your help. And then two of my dear colleagues, Kelly Morrow, who's be the second speaker, and then Dr. Aiko Bailey, who is going to do the Qigong session for us. With that, this is who we are. Osher Center for Integrative Health at the University of Washington. Osher is the name of the gentleman who actually gave the endowment. He's based in San Francisco, and he's 97 years old. His passion has been healthcare and integrative medicine in healthcare. So we are one of the 11 centers. These are the other Osher centers that we have across the country. And there is one in Sweden, Karolinska. And the reason there is one in Sweden because Mr. Osher's wife is from Sweden. So that's how we ended up in Sweden. Our Osher Center at UW came to existence in 2018 through the endowment from the Osher Foundation, and we have grown significantly since then. I have had the pleasure of being the director of the center for the past 2 years. And let's see. Let's talk about our services, and then we get to Chachimi. Our services we are a clinic without borders. We are a center without borders. Hopefully at some point we'll have enough funding that I won't be saying without borders, then we'll have our own place and our own clinic. But right now, our services are embedded in different clinics throughout UW. We function out of 3 main clinics. One clinic is in Ballard, the other clinic is Northgate Clinic, and the other one is in Factoria on East Side. The services that we have right now are acupuncture, naturopathic services, massage therapy, integrative medicine consults, and also integrative medicine in primary care. We are hoping to have more practitioners. When I started as a director about 2 years ago, there were only 3 of us, and now I have a team of 15. So we have done an amazing job, and UW has been very supportive in supporting these initiatives throughout UW. We have partnered with Ming Endowed Lectureship. These are endowed funds at the Department of Internal Medicine, and I have the honor of overseeing these funds. Thanks to the Ming family, these seminars that are community-facing, educational-facing community are possible. They fund these seminars. So we are very thankful and grateful to the Chachimi family for the funds that provide for these activities. The speakers today, this is me. You can read on our website, and then my dear colleague, Kelly Morrow. Kelly is our dietitian, nutritionist. I've known Kelly for many, many years. We started working together directly and indirectly at Bastyr University. If you don't know where Bastyr is a naturopathic and acupuncture school in Kenmore. And this is where I actually did my education in acupuncture. I got my master's degree in acupuncture from Bastyr, and Kelly was there, so we were running a shift, immune wellness shift together at the time. My other colleague today, who will be working with us, guiding us, directing us through the Qigong activity, is Dr. Aiko Bailey. Aiko is a graduate from Bastyr University, and she has got her doctorate degree from school in Portland. She is part of the Osher team and provides acupuncture services, and I can say she's an expert in Qigong and body movement therapies in Chinese medicine. We'll talk a little bit about ancient wisdom for modern caregiving. Then we'll have a very brief 15-minute Qigong practice that's going to happen outside behind this wall here. Then we're going to take a break, and then Kelly will be talking about nutrition, diet, and how it can help us as caregivers. We all have goodie bags. In the goodie bags, you have some goodies that Kelly will explain it, that the components and how to actually pick a goodie for ourselves. So with that, Care for the Caregiver series. Before I dive into it and talk a little bit about it, is if you go to our website, we have done this. This is the second year that we are doing this Ming series so structured. Last year, the series were about nutrition and brain health, and all the series have been recorded. So if you go to our website, you can actually watch those series. And this year, the theme would be Care for the Caregivers. This is one that we are doing in person in this side, in Bellevue side. This is the first time that we are in Bellevue side. And we have 2 other sessions. I believe it's in October and November. So just stay tuned. We'll send the information. And one of them will be in person, and the other one would be virtual. But if you cannot attend, that's fine. We'll try to record everything and put it on the website. So, caregiving, what is it? When did it start? When did it happen? We don't know. As long as we know that in the animal kingdom, caregiving exists. You look at animals, they care for each other, they provide, and then it comes to the humans. Humans, as we know, when we started building communities and families and everything, one form and another, we are caring for each other. This care means emotional, financial, protection. At some point, this caregiving is for somebody younger than us as young parents. At some point, this care is for somebody older than us, for elderly parents, and at some point, it's for a spouse, same age. But this notion of caregiving has already been with us. And as humans, we have been doing it directly and indirectly. For some of us, these photos are very familiar. Multi-generational, cross-generations caregiving. For me, yes, that's how I grew up. In a family, my grandparents were there, and we were there, my parents were there, so everybody would participate, everybody would take care of each other. One way or another, they would tell me, can you go with grandma, go to the doctor? And I say, sure, I'll just take her. Or learning skill set from my grandparents. They would spend more time with me than my parents because my parents had to work. But then the grandmother would cook, and so it was very meshed together, and that was ideal. It can get a bit messy, it can get a bit chaotic, it has its own pros and cons, but looking back, it was very satisfying, it was gratifying. So when we talk about caregiving in the families, I think for a lot of us, maybe that's the expectation. But reality ended up being like this. Nuclear families, single moms, single parents, that they have a young one, they have an older one, they're taking care of their parents, and there's not a lot of support for them, and they still have to work, they have to make a living, they have to take care of themselves, they have to take care of family, and it comes with a price. That noble action of caregiving, that noble act of I would like to take care of somebody, at some point starts becoming a burden, starts becoming too much. And then are there ways that we can actually help ourselves as caregivers to be more resilient, to actually be more present in our caregiving action, in our caregiving activities that we have? So this is what we're going to visit together. So a noble cause with psycho-emotional and physical impact. I was reviewing the literature, and there's a lot of literature out there about caregiving and the value of the caregivers. There are many different groups now that are actually advocating for caregiving, like nurses or caregivers, professional caregivers, that in the society, like our society in the US, it's not doable, it's not feasible that we expect family members to be caregivers. So we should have professionals that actually can come in, they can jump in, and they can provide care. And it doesn't mean that as family members, we are off the hook. No, by all means, we can be part of this activity, but because of this, from moving from feeling good into burnout, then it becomes a burden. Then families start having dysfunctional relationships, or individuals will be feeling burned out. So in many of the studies that I reviewed, There are three different components that every single caregiver, non-professional caregiver, meaning a family member, they commented on. One of them was psychological effect, emotional, and physical impacts. They all express higher level of dissatisfaction in life and having higher chances of being depressed or feeling depressed. The next one was having anxiety around what is happening to my loved one, what is happening with me, what is happening to my life, or just having general anxiety or phobias. It would affect their sleep. They would suffer from insomnia. They couldn't sleep well. And if they're not sleeping well, then their caregiving activity will be impacted. Then it would have somatic. It would have body presentations, and they would present like body aches, fatigue, constantly feeling tired. There is something wrong with me. I don't know what it is. They have done all the tests and everything. We call it stress. Oh, I can't find anything. Let's call it stress-related. Maybe it's not, it is stress-related, but maybe it's just the fatigue of constantly being in a state of, I need to be vigilant to take care of this individual, and that has burned me out. So those are different aspects of being a long-term caregiver, a non-professional caregiver. The reason I emphasize on the term non-professional, because as professionals, they learn how to separate, correct? They're doing a job. They separate the emotions and the feelings from the action. So then they know this is what I do. I'm not taking the emotions, the feelings with me at home. It stays here with this individual. But for a family member, it's completely different. We live and we breathe it, correct? It's with us 24/7. So all these individuals that they were in the different studies, they were showing this increased level of sympathetic nervous system activity. How many of you guys are familiar with sympathetic nervous system? Okay, it's the fight and flight, correct? It's the fight and flight. It's the nervous system in the body that keeps going, go, 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 do, 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 do. It's the sympathetic nervous system. Okay. Is there another nervous system in the body that tries to counterbalance this sympathetic nervous system? Yes, we're going to review it now. This is our autonomic nervous system. Why do we call it autonomic? You have no control over it. This is a nervous system that controls our life activities, our functions, like breathing, like digestive system, sleeping, to some degree, our mood and everything. It's autonomic. It does its own job. It does its own work. It has two branches, sympathetic nervous system and parasympathetic nervous system. Sympathetic nervous system is the culture that we live in. Go, 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 go. Do, 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 do. Everything is hot. It had to happen yesterday. There is no time to waste. We need to keep going. Look, the somatic indications of it. It dilates the pupils. The pupils get dilated. Why? Because I need more light coming in. I need to see everything. I have to be in the state of hypervigilance. Or inhibits salivation. The mouth is dry. So the mouth is dry, the digestion is dry as well. This is why people who are in the state of hypersympathetic nervous system tone, they have constipation. They do not digest, they do not absorb nutrition. They think that they're eating very healthy, but they're not digesting and they're not absorbing the nutrients. So they have nutritional deficiency. And then it slows down digestion, stimulates glucose release. Blood sugar goes up. Why we are having so many people having type 2 diabetes? And we tell them, you know what, it's stress-related. Believe me, exercise, relax, sleep, your blood sugar will come down. Can they? Maybe. Can they? Maybe not. So we don't know. But stress and high tone of sympathetic nervous system is one of the factors that blood sugar in the body goes up. And then it produces adrenaline function. What do we know about adrenaline? What hormone comes from adrenaline in the body? Cortisol. You have heard about it, correct? Cortisol causes inflammation. So the more cortisol we have, the more inflammation we have. When everybody is in a state of high sympathetic tone, we produce more cortisol, there's more inflammation, and everything is very intense in the body. Now, and then the last one was very interesting. reduces blood flow to the genitourinary reproductive system. It's shocking. It's just mind-blowing as a physician to see how many young men and women are coming and complaining that I don't have the libido, I don't want to be sexually active, we are having difficulty conceiving, having children, we have erectile dysfunction, we have this problem and this problem. This didn't exist about 20 or 25 or 30 years ago. And now everybody wants to be on medication. The medication is not the solution. The problem is here. We need to tone it down. We need to bring the sympathetic nervous system down and let who talk? Let parasympathetic nervous system talk. So what does parasympathetic nervous system do? It increases saliva in the mouth, okay? So now when I'm eating the food, it starts mixing with my saliva, the digestion starts in the mouth, absorption happens easier, my bowels are easier, I can relax, my heart slows down, stimulates digestion, and then causes erection and it supports the reproduction. Okay, so clear? These two need to work in harmony. It doesn't mean that one of them should completely be silent and the other one talk. No, they need to work in harmony. There are times that we need high tone of sympathetic nervous system. You're crossing the street, somebody honks at you. You need to run. You need to jump on the other side of the street, correct? But when you're on the sidewalk on the other side, okay, the danger is gone. Calm down, deep breath. Now your parasympathetic nervous system needs to kick in. So they have to work with each other constantly. Okay, we created this concept because I want to take you guys here now. Now we are going to Chinese medicine. Traditional Chinese medicine, East Asian medicine, has this concept of yin and yang. Have you heard of yin and yang? The female and the male in the body. Yang very kind of roughly translates into the sympathetic nervous system, is the energy in the body that dominates the day. During the day, at some point you wake up, we have to get things done. It's go, 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 and we achieve something, and towards the end of the day, we kind of wind down, we start to cool off, then we relax, and we get ready to go sleep. Then yin or ying, you can use them interchangeably, kicks in. So yang, again, roughly sympathetic nervous system, yang, parasympathetic nervous system. And in Chinese medicine, we say there should be a balance between yin and yang. What happens in our lives is that as we get older in life, inherently the amount of yin goes down. Women, when they hit menopause and postmenopause, the amount of yin goes down. Estrogen and progesterone, those two female hormones in the body, they are yin supporters. So when women hit menopause, the amount of yin goes down. So they become more yang. That's why they have a lot of night sweats. They have hot flushes. They don't feel comfortable. They feel restless to some degree because there's too much yang. There are ways to balance them. One of the ways is nutrition. One of them is breathing technique, resting, exercise. So these are the things that we're going to visit now, and we're going to practice a little bit together. So the goal here is that we are going to help the yin to counterbalance yang, to get into the state of calmness, to get into the state of being present and build resilience. That eventually is going to help me as an individual and my cause as a caregiver. The modalities that we can use in traditional Chinese medicine and Eastern medicine to balance yin and yang. Acupuncture. There are many studies that show acupuncture is really good in releasing stress. How does acupuncture do that? It depends how you use acupuncture. There are some times that we use acupuncture very locally. Somebody has a sprain in their ankle, and we use acupuncture to reduce the inflammation in the ankle and increase mobility. And there are times that people come for insomnia. You say, oh, the root of the insomnia is the stress. So if I use specific type of acupuncture, specific points on acupuncture, I can reduce this stress. I can help this individual with their anxiety and their sleep. Then we have herbal medicine. Herbal medicine is a huge topic as part of Chinese medicine. We are not getting into it, but I'll show you a slide and talk a little bit about some teas that we use to help people with their anxiety and calming their nerves. Rest and recovery. I love this. This is why my favorite, the art of doing nothing. And we'll talk about it a little bit. Then we have emotional and spiritual practices, nutrition, which Kelly will talk a little bit about nutrition, and mind-body practices, which Aiko will help us doing some Qigong. Okay, acupuncture. Acupuncture have different forms. We have Korean acupuncture, Japanese acupuncture, Chinese acupuncture, Vietnamese mixed with French acupuncture, auricular acupuncture, only needle in the ears, or body acupuncture. So there are different forms of acupuncture that we can use. But there's a lot of data that shows acupuncture is really good in reducing stress in the body. It balances the autonomic nervous system, the sympathetic and parasympathetic nervous system. You're seeing a lot of use of acupuncture in kids who have Pott's disease. They have a dysfunction of their autonomic nervous system, correct? Dysautonomia. If you have heard the term, they have dysautonomia, they come for acupuncture and they get very good results. They become more functional because acupuncture balances this function of the sympathetic and parasympathetic. This is one of the services that we have in our clinics right now, and I think we have 5 acupuncturists right now that we provide services in 3 clinics. Herbal medicine. Herbal medicine is very complex. It's a very big topic. I just wanted to talk a little bit about the teas that we have. These are the most common teas that you see in the market that people use to calm their nerves, so to speak. The reason I picked this slide and the reason I wanted to mention it here is that not all teas are equal. Not all herbs are equal. They look different, they smell different, they taste different, and they have different effects. And they have different side effects, correct? So it's not like because lavender worked for me is going to work for you. It's not because chamomile worked for this individual is going to work for me. But we keep hearing it, oh, try this, it helped me. And patients come and say, oh, it really didn't work for me. Yes, it was the wrong tea for the wrong individual. Chamomile. We hear a lot about chamomile. Chamomile is excellent. It's excellent to calm down the nerves. People take it at night. They start taking it at night. The next thing that they start complaining about is, I can't sleep because I have to go to the bathroom all the time. Chamomile is a diuretic. So in men who have issues with their prostates or women who have prolapse of their uterus that have to get up and go to the bathroom quite often, that is not a good choice because then have to get up and go to the bathroom all the time. Then in the morning they're exhausted because they didn't sleep, even though chamomile is a relaxant and calms down the nerves. Green tea. We have heard a lot about green tea. Green tea is an immune booster. It's good for the sleep. I wouldn't necessarily categorize green tea as helping with sleep more than calming down the nerves. So it's an anti-anxiety that can be used throughout the day. And I have to mention that all these teas here, they're pretty safe. They do not have a lot of interaction with drugs and medication that we are worried about. And if somebody is really worried they want to have surgery or they want to do something, if they stop for 2 or 3 days drinking this tea, it's out of your system. So there is no concern there. Rose tea. I remember as a kid, my grandpa would give us a lot of rose tea. The next thing that you know with rose tea is you get diarrhea. So it's a cleanser, actually. It's really good for the liver. It detoxifies the liver, it cleans the liver, and gives you some loose stool. But if somebody has IBS, people have IBS, they have Crohn's disease, or IBDs, they should not be taking rose tea, correct? This is actually contraindicated. They should not be drinking this tea. It gives them more loose stool. It increases the chance for bleeding. It gives them more cramps. So yes, it is good for sleep, but in who? Then we have peppermint. Tell me, what does peppermint do? It causes reflux. So if I already have reflux, if I already have hyperacidity in my stomach, this is not a good choice for me, correct? I drink it at night. I'm hoping that's going to help me sleep. The next thing I know, I keep waking up because I have worse. My reflux is worse now. It's because of the peppermint. Then passion flower is relatively good. You can use it in kids. and lavender and valerian that are very safe. Valerian sometimes had a side effect. It goes the other way. People take valerian and they can't sleep. We call it an idiosyncratic effect. So it's just the opposite. They take it to calm down and they get all wired up. It's same with kava and valerian, these two. Then we have lemon balm. Lemon balm, again, is quite benign. It's a very shy plant. It's there, you drink it throughout the day. You're feeling calm, not in a necessarily passive way, but you just feel more present. So that was the reason, but we have herbal medicine that can offer solutions for people to build resilience. Then rest and recovery, do nothing. If you do a quick Google search, there are many books now being published about the art of doing nothing. Can we do that? No. The culture here doesn't support it. You need to feel guilty if you're not doing something. You have to keep going. How dare you sitting there doing nothing? I was reflecting on it actually. Many years ago when I was a kid, well, maybe 10 years ago, but anyways, we passed that. I would go and stay with my grandma. I'm originally from Iran, so I would go to another town with my grandma, and there were times like she would wake up, she would do some cleaning in the kitchen and make the lunch and everything, and would just sit on the porch looking at the garden. And so, Grandma, what are you doing? And she would, nothing. And it wouldn't register, what do you mean, doing nothing? And then, as a kid, you start asking questions. And I remember that she would just pick up this flower and give it to me. Said, do you know what the name of this flower is? And I said, no. Said, the name is sit, observe, be quiet. That's the name of the flower. So as a kid, it came to me, it was pretty mean. She was telling me to shut up and don't ask any questions. But that's exactly what she wanted. That's exactly what she needed. Do nothing. So as a caregiver, is it possible for me to do such thing? Yes, I don't need 2 hours. I only need 10 minutes. I can take a break, wherever that place is. If it's a beautiful garden, I can just be laying and looking at the sky, but do nothing and don't feel guilty about it. I can practice it 2 times a day, 10 minutes in the morning, 10 minutes in the afternoon. And that would actually calm down the nerves. That would actually let the parasympathetic nervous system to come up. You'll be feeling much, much better. But it's difficult to pass that point of feeling guilty about doing nothing. Then this one, emotional and spiritual practices. Prayers, meditation, mindfulness practices, everything that brings us to being present. A lot of the times, what stresses us is this condition. There are too many stimulations. There are too many things happening at the same time. Somebody's talking here, the phone is ringing, I have to sign a document, then the emails are coming. At the same time, my mom is calling me from downstairs, what do you want for lunch? And okay, you know what, I don't want anything for lunch, let's deal with one thing at a time. But it's not possible, but I can do this. I can create this sphere even for 3, 4, 5 minutes. It's just me. It's me in my space, in this space. I focus on my breathing. I'm not paying attention. The sky is not falling. Everything can wait. But it is my self-care. This is how I calm down my nerves. Okay, for some people, this is not the ideal way of doing it. This is the ideal way. Like for me, I can't do sedentary things. I just fall asleep. If I sit and don't do things, I fall asleep. I need to keep moving. So walking my dogs is a dynamic, mindful practice for me. When I go out with my dogs, I'm present there for my dogs. I'm present with the dogs. There was a time about 20 years ago when I came to US that I would go to the park and it was fascinating. You see moms are bringing their kids and the kids are playing and everybody is on their phone. The kids I remember exactly, the kid jumped off the an edge or something, and I looked at the mom, yelled at, Mom, did you see it? And the mom said, yes, honey. She didn't say it. You missed the moment. That moment is not going to happen again. That's it. So we need to be present. In that moment, whatever we are doing, just walking in this beautiful garden, mindfulness, being present. Again, it doesn't need to be too long. It could be just doing the dishes, that 10 minutes of doing the dishes. That's how I block everything out. I create this sphere, I create this environment. It's me, this mindful, mindless, together action of doing the dishes. I'm mindful because I'm present at what I'm doing right now. It's mindless. I don't need to think about doing the dishes. I've done it gazillion times. I know exactly how to do it. So the repetition of it brings some degree of comfort to me, correct? I have repeated this so many times that I feel comfortable, but it's the mindfulness and being present at that moment. Then, breathing techniques. Breathing. Would it calm me down or not? We have heard a lot about this, correct? Belly breathing. And now they've started teaching belly breathing in schools to kids to calm them down. Like in some of the movies you see it, that when kids are panicking, like a good example was what? World War Z with Brad Pitt and his kid. The zombies are coming and the kid is panicking and they look at the kids and breathe, deep breath, and the kid calms down. So it's becoming a known practice that deep breathing or belly breathing, as we talk about it, calms down the nerves. It's very easy to do. We don't need to do anything. Right now you're sitting there, you can do belly breathing. You can lay on the floor for 3-4 minutes and do belly breathing. It doesn't really need any instruments, any tools, any gadgets or anything. You can just put something on your belly and make sure when you take a deep breath in, it goes up. So we breathe through our belly. You hold it briefly and you exhale, and then the belly goes down. So look at my belly. I'm gonna exhale, I'm gonna hold, I'm gonna inhale first. Inhale, hold, exhale. There's a pause. There's a very small pause between my inhale and exhale. Now, why is deep breathing so calming? What is the big muscle that's engaged in deep breathing? The diaphragm. I have my chest, I have my abdomen. Between the chest and abdomen, I have the diaphragm. Diaphragm is a big muscle. It's the biggest muscle involved in breathing and digestive system, correct? So when I take a deep breath at belly breathing, diaphragm goes down. It pushes on my intestine. So it starts moving my intestines. When I exhale, the diaphragm comes up. If I have a shallow breathing, this is what happens. This is my diaphragm. In a shallow breathing, this is not what diaphragm does. Up and down, up and down. In a deep breathing, this is what it does. It goes up and down, and up and down. So it has a wider range of movement, correct? Okay, so what's the significance of it? Diaphragm, as a muscle, it has a nerve. The nerve is a vagus nerve. That's the name of the nerve. Vagus nerve is part of parasympathetic nervous system. You remember? We talked about sympathetic and parasympathetic nervous system. Vagus nerve is part of the yin energy in the body. So when I do deep belly breathing, what is happening, I'm stimulating the parasympathetic nervous system. That's why it's calming. That's why, as I keep doing more belly breathing, my nerves will calm down. There is a saying in Buddhism, everybody is gifted a certain number of breaths. You can either breathe shallow and fast and live short, or you can breathe deep and slow and live long. pick. So that's why in Buddhism, meditation, they always practice deep belly breathing. Slow down, slow down. And in that way, it slows down the heart rate. Okay, so Chinese medicine, restoring the balance between yin and yang, restoring the balance between parasympathetic and sympathetic nervous system, building resilience. It comes with different forms. We are all caregivers. We have to do what we have to do. We are looking for routes to help me build resilience. There are things that I can do it myself, like focusing on my nutrition, some herbs, doing some meditation, being mindful, and belly breathing. And there are some things that I may need some help. Going getting acupuncture, going getting massage, going out there, doing something more fun. So by mixing what works for me, I can actually make sure that I protect myself, build more resilience, add into my own resources, because I cannot provide something that I don't have. I cannot give if I don't have it. I have to build health for myself, then I can take care of the individual who I want to make sure that they stay healthy. And with that, don't forget to take a deep breath in. Breathe in and out. Thank you very much.